Plastic Surgery, and it's Hump Day with Dr. Alex Earl. Lots of you guys know me by now, but for those that don't, this is the time we get to spend with you guys. And of course, we go over plastic surgery topics, do a little education, and I'm happy also to answer any questions that you guys may have regarding any plastic surgery topic from head to toe. All right, and you know you're getting good, reliable information because I'm a double board certified plastic surgeon. Okay. So a couple of things. Number one, those that do know me may be wondering, like, what is going on with your face, Dr. Earl? So yes, as a reminder, I do have the mustachio going on, and that's for Movember. So it is No Shave November, or Movember as it's known, and that's where we are thinking about and promoting and donating for towards men's health issues. Okay, so whether it's physical or psychological. So this is a month that we kind of dedicate to that, and that's why I have this bad boy going on right here. So yeah, so I'm gonna be wearing the mustache all the month of November for Movember, when we're thinking about men's health issues. Okay, now. Today, we're also going to have the secret promo. Okay, so that means that if you decide you want to have surgery and you go ahead and fill out the virtual consultation form today and you give them the secret password, you're going to get a whole bunch of money off your procedure. All right, it can be anywhere from $300 to $1,000. Okay, so it's a bit of a surprise there, and you got to use the secret password, which today is going to be BMI. BMI is going to be the secret password. All right, so you go to our website, Pure Plastic Surgery, so www.pureplasticsurgery. You go to virtual consultation, you fill in the information. Once the coordinator reaches out to you, you give them the secret password, and you get lots and lots of money off your procedure. All right, so keep that in mind. So today we're going to be talking about body mass index, okay, BMI. And why do we talk about that? Because it's very, very important in terms of what we do or the patients that we accept for completely elective surgery, right? So everything that we do here at Pure, especially in our office-based surgery setting, is considered a completely elective surgery, and therefore we have to have very, very high, very, very tight safety standards, because at the end of the day, that's what it's all about, right? Our number one priority is your safety. Okay, and so part of that has to do with your BMI. So we only accept patients that are healthy, and we only accept patients that are within a certain BMI range. So a lot of times we're asking patients what their BMI is, and they don't really know what it is, they don't know where to look it up, and they don't understand why it's important. Okay, so that's what we're going to go over here today. So BMI starts for body mass index, okay, and there's actually a little formula to it, and that's the formula here. So it's essentially your weight. And if we're doing it in pounds, then yes, you can do your weight in pounds over your height in inches squared, okay? So weight in pounds over the height in the inches squared, and then you're multiplying it by this, what seems like a completely random number, 703, to get you your BMI, okay? Now, why does it look a little clunky like this? Because BMI was originally done in units such as in kilograms and in centimeters, okay? So that's why you have this kind of this fudge factor here, so that when you do it in pounds and inches, then it comes out to the same ranges, all right? But the good news is that you don't really have to worry about the formula itself. You can just go to Google. So go to Google, Google BMI calculator, input your height, input your weight, and then that's gonna then spit out what your BMI is. And then, once you have that number, you have to see where you fall in terms of the categories. There are multiple categories. So if your BMI is less than 18.5, then you're considered underweight. Okay, means that your weight is too low for your height. And so a lot of people that are less than 18.5, they may be a bit too skinny. They may be malnourished. Maybe they don't have enough of the protein and nutrients and vitamins that they need. Okay, so if you're under 18.5, you should consider gaining weight if you can, or seeing a doctor or nutritionist or someone to help you gain a little bit of weight. And when we're talking specifically for most of the surgeries that we do, especially for BBL, that would be way too low for BBL, even a skinny BBL. Okay, even a skinny BBL. All right, what's considered quote unquote normal is between 18.5 and 24.9. Okay, And of course, a lot of you may be asking, well, normal for who? And this is just a general consensus, okay? Once you get above that, so BMI of 25 to 29.9, that's considered overweight. And in the US, a lot of people fall in this category, including myself. I'm in that category as well. Okay, so I'm not normal. I'm over here. All right, but then is when we start getting into trouble. Okay, so once the BMI goes above 30, between 30 and 34.9, that's already considered obese. That's obesity class 1. Okay, then between 35 and 39.9, obesity class 2, and then anything greater than 40, obesity class 3, which is commonly known as morbid obesity. Morbid obesity. Okay? And why is that? Because once your BMI gets above 40, then you start getting other health issues that are being caused by that obesity. So that's just a matter of being overweight, but then you start getting diabetes, you start getting respiratory issues, okay? You start getting high blood pressure, and all these things start happening to your body because your body's not meant to be carrying that much weight. It's not meant to be having that much fat. Okay, of course the cholesterol shoots up, chances of heart attack goes way up, etc., etc. Okay, so that's the issue. Once you get into these obesity classes, complications start to go up. Okay, now I think, and I'm going to talk about my max BMI in a little bit, which is actually 30. So, my max BMI is 30. I don't want to really get into that whole obesity category. I think, perhaps here it's reasonable if you're super healthy, okay? But I would say personally that anything, any BMI greater than that, I definitely would not do completely elective surgery on you. It's just not worth it. Okay, because the chances of complications start going way, way up. Okay, especially with general anesthesia, and especially with a little bit of the longer cases, for example, mommy makeovers and BBLs. Okay, and what are these complications that start to go up? Well, we see higher rates of infection. Okay, as you start getting into these categories, we see much higher rates of respiratory issues. Pretty much coming out of general anesthesia, not being able to take deep breaths, which can then lead to pneumonia and other infections and issues like that. And low oxygenation levels. Low oxygenation levels means that your blood doesn't have what it needs to heal. So then you're going to get into wound breakdown and wound healing issues. All right? You do a tummy tuck, for example, and someone who has say a BMI of 39, it's quite possible their incision is going to bust open. Okay, and then they're looking at an open wound that they have to treat with a wound vac, etc., etc. All right, and then this is the really dangerous one here. Okay, this is a very dangerous one here, and that's DVTs or deep vein thrombosis, and PE, which stands for pulmonary embolus. Essentially, blood clots. The higher the BMI, the higher the chance of blood clots, and blood clots are dangerous because they can kill you, instantly. Okay, if you get a PE, you could potentially go down just like that. That's a very, what's called a saddle embolus is a huge blood clot, gets stuck in the lungs, and therefore the lungs get no blood flow. You can't exchange your gases, you can't get oxygen, and the patient passes away. Okay, and that's why this is so important. Okay, so my max BMI is 30 because I want to minimize complication rates as much as I can, right? As you all know, here at Pure Plastic Surgery, your safety is our #1 priority, and we do multiple things to ensure your safety. For example, ultrasound BBL, joint commission certified operating room, etc. And one of those things is making sure that the patient is, in a risk category where they're going to have the least risk possible. Never zero, though. Remember, this is medicine, this is surgery. Nothing is 0%, nothing is 100%. You can be completely healthy, BMI of 25, and still have an issue. But we want to decrease the chances of having that issue as much as possible. So my max BMI is 30, so that puts you basically in the kind of overweight and normal categories, okay? So, for example, for the BBL, the lowest BMI would probably be about 21 because we need enough fat to transfer. And then the max BMI is going to be 30, okay? Now for breast augmentation, for example, we can get into a little bit lower BMIs. We can get up to from the 18.5 and up. Not below 18.5 because then the patient may be malnourished and we got to make sure that you're healthy, Okay. And for tummy tucks, the BMI can be anywhere between say 19 and 30. Okay. All right. Now a lot of patients ask this question. Well, doc, what about if I work out and I put on a bunch of muscle? All right. That's of course going to increase my weight because muscle weighs more than fat. Okay. And then that's going to increase my BMI. All right, and it does not mean that I'm unhealthy in all these issues. And the short answer is yes, you are correct. Okay, and that's why this is not the only thing that we look at, right? It's not the only thing that we look at. We look at BMI, we look at your questionnaire, we look at your photos, right? So if I see a little bit of a higher BMI, say BMI is 32, all right, but you send in the photos and I can see that it's not due to just being like having a lot of excess fat in the body, but because you're working out and you have more muscle mass, then I may make an exception, okay? I'm not gonna say I'm always gonna do this, guys, and don't go crazy now, all right? But if in that particular case, I can see that it's due to muscle mass, okay? Then maybe I'll make an exception and go up with a BMI of 32 as opposed to 30. Now, I have very rarely seen, though, in our patient population, anyone that go over, actually not even to 35, anyone over like 33.5 who doesn't need to lose weight. It's very, very rare that we would see that, okay? So that's definitely what we're looking at. So that now you understand the body mass index, you know how to calculate it, okay? And you can understand why it is important, all right? Okay, I'm happy to take any questions.
Okay. Well, this is a suggestion. Can you do an informational live about brachioplasty?
Yeah, definitely. So that's a procedure that we do here very often, and we can do that for the next live. If you'd like, we'll definitely talk about brachioplasty.
Okay, doctor, can you do a... What happened with the question? Disappeared. Sorry. Doctor,
All right.
okay. Doctor, can you do body tight on abdomen with a mommy makeover?
So typically you don't need that because when you're doing the mommy makeover, you're doing a tummy tuck, right? So the most common procedures that you do with a mommy makeover are a breast procedure and the tummy tuck. That's kind of part of the definition. So if you're doing a tummy tuck, then you're already dealing with the excess skin, and you don't need to add body tight on top of that. Now, some patients ask, can you do a little bit of etching with your tummy tuck? And the answer is yes. So if you're the right candidate, we can do a little bit of etching at the time of your tummy tuck to give you a little bit more of an athletic look. And like I said, in that case, you don't need anything like body tight or J-plasma.
Can I still book a consultation if I'm almost close to 30 BMI?
Yeah, so that's where you have to be reasonable, right? So say for example, you want to do your surgery and your BMI right now is 32, okay? But we're booked out pretty far. Like I think our next openings are sometime in February or March. So I think it's reasonable to go ahead and book now, but you do have to commit, okay? So a lot of times all you need to lose is something like 10 pounds or so, which is very doable, within 2 months. But we do require that commitment though. So, we'll get you booked, we'll put you through the entire process, but when you come in for surgery day, we are gonna check, okay? We're gonna check that BMI, and it needs to be 30 or below on surgery day, okay? If it's higher, then sometimes we need to cancel or postpone the surgery, and unfortunately you would lose your deposit at that point in time.
Okay, this is for the TikTok community. Doug, it's late for me. How I calculate my BMI? So I guess
no
she
worries.
came late for the...
if you came in late, no problem. I'm happy to answer that. And also remember that we put all of these talks on our YouTube channel. So you can always go to search Pure Plastic Surgery on YouTube, and you can have all the talks, and you can watch them at your leisure. Okay, but the formula here, like I said, it's weight over height. So the weight can be in pounds and the height in inches. So you have your weight divided by your height, but the height is squared. So divided by the height squared, and then you multiply that by this fudge factor, 703, and you'll get your BMI. But the easiest way to do it is to simply go to Google. Google BMI calculator, put in your information, and then it'll give you your category. And then from here, you can see where you fall, right? In all these different categories here.
Okay, I had a mommy makeover. What scar cream do you recommend?
So I really like silicone-based scar creams, and the one that we use here is called Silogen. All right, so Silogen is the one that we use here.
I think
Let me
up
see.
there.
I'll write that over here. So Silogen, and actually, quite fortunately, we have a little pamphlet here, so we can take a look. Can you guys see that there? All right. So this one works really well. There's two options for the cream. So there's your regular cream, and then there's one that has sunblock in it in case you're going out in the sun. And then on top of the cream, there's also different like silicone type sheetings that you can use. You can place over the scars, and those work really well also. So I highly recommend the Silogen. You can start using it at 2 weeks post-op. All right, and you can use it. I would use it for at least the first 3 months. But remember, the lifetime of a scar is up to a year. So you have 12 months to work with that scar to try to get it better and better.
Can you do etching with Lipo 360?
Definitely. So that's a great procedure. So you can add what we call HD or high definition lipo to your lipo 360. And what do we do there? We etch things out in a way to define your abdominal muscles to give you a more athletic look. So the rectus muscles, which are the ones that come kind of up and down, those can be defined, as well as the ones that come along the side here, which are called your obliques. So we can define your rectus, define your obliques, and give you a beautiful athletic look. Now the key though to etching or HD lipo, high definition lipo, is that it requires a lot of maintenance afterwards, okay? You can't get an HD lipo and then start eating McDonald's and not go to the gym. All right, it's gonna look terrible then if you do that. All right, so you have to get your HD lipo, and then you gotta dedicate yourself to your nutrition and workout routines.
Okay, already had lipo BBL, and
Yeah.
4 weeks post-op. Why may I feel I swell up more at night? Lipo areas
Yeah.
burn at night.
So yeah, I mean you're still relatively early in the whole kind of recovery phase, so you're still going to swell up. And I've had a lot of patients, especially in the lipo areas, but in their legs as well, that it actually gets a little bit worse, around week 4 or 5 or 6. Okay, and that's not unusual. So what I can tell you is, don't fret. It's most likely going to be okay. But you're just very early still in the recovery phase. It's going to take at least 3 to 4 months. So just continue with your compression. You got to wear your faja night and day still, okay? And continue with your massages. You can get perhaps a weekly maintenance massage by a professional. And then you can massage yourself with a lipo roller. And that tends to help a lot too. So once a week with your professional, and then the other days you do yourself with that lipo roller, and that helps your body kind of get rid of all that fluid through the lymph system.
Okay, I'm at California, so how can I book a consultation?
Great question. So the easiest way to do it is to go to our website. You're going to go to www.pureplasticsurgery.com, okay? And once you get in there, one of the first things you're going to see a button that says virtual consultation. You hit that button, and then there's going to be a questionnaire. Make sure you answer all the questions, and it's also going to ask you for some photos, okay? So you upload the photos, fill out the questionnaire, and boom, hit send. That's going to come to one of our coordinators, and then the next thing that's going to happen is that coordinator is going to call you, okay? And that's when they're going to get into all the details. So, for example, if you're looking into multiple procedures, say like you want a mommy makeover, arm lift, etc., don't worry if the questionnaire only allows you to put one thing. Don't worry about that. Just fill it out, send us your information, because then you're going to get a personalized call from one of our coordinators, and she's going to go over everything that you need to go to. She's going to give you a whole bunch of information, and she's going to work out all those details.
How long after a round 1 lipo 360 plus BBL should I wait to get a breast augmentation?
So you want to wait at least a minimum of 3 to 4 months, okay? So about 3 to 4 months in between surgeries, you want to make sure that you're pretty well recovered from your lipo 360, and that a lot of the swellings come down, and you're pretty mobile and everything else. And also if it's a BBL, you want to make sure that you're able to kind of lay on the buttock and hips, right? So you want to wait 3 to 4 months, and then you can do your breast augmentation.
Can I have Lipo 360 and a tummy tuck scar revision at the same time?
So, if that's all it is, meaning that yes, we're just revising the scar, right? We're not doing like a mini tummy tuck or muscle repair or anything else. Then a lot of times, yes, you can do that. You can do your Lipo 360 or BBL with your scar revision. Okay. Now, if it's something bigger, like it's like a full tummy tuck or full breast lift or something like that, then we need to separate those surgeries and stage them.
Okay, this is a common question, and it's how long should I wait after a round 1 to get a round 2 Lipo 360 plus BBL?
Great. So now we're having 2 rounds of the same procedure, right? So as before, where I said you can do a lipo and then a breast aug in 3 to 4 months. Those are 2 different procedures, right? But now you're going to go and have the same procedure over again, so a true round 2. Then you have to wait longer. You have to wait at least 9 months. Okay, ideally a year, but the minimum will be 9 months before you do that again, because you develop a lot of scar tissue after that liposuction. Okay, there's scar tissue, there's inflammation, there may be some degree of fibrosis, and if you try to go in too soon, well, number one, the surgery is very difficult. It's almost like trying to chisel through concrete. Number two, it becomes really bloody. So it increases your blood loss and your risk for needing a transfusion. And number four, it's much less effective, and we're not going to be able to get as much fat out. So in the end, you're just going through all this pain for minimal gain. Okay, we don't want that. So you want to wait at least 9 months, preferably a year.
Okay. How much weight do you need to gain for a skinny BBL?
All right, so skinny BBL. So we were talking about BMI. So what is the lowest BMI for skinny BBL? Probably 21. Okay, that's for your skinny BBL. Or if you really want to go for it for your South Beach butt lift, which is what we do here at Pure. Okay, so how much weight? Well, it depends on your height, right? And it depends where you're at. But the key is that you need to get that BMI to 21. All right.
Okay, 21.
That's right.
Can I undo ab etching, and can we change a bubble butt to a slope instead?
Yeah. Okay. So, great question.
Two
Okay.
questions.
So, number one, like I said before, if you're doing high def lipo or ab etching, you really have to work hard on maintaining that. Okay. And if for whatever reason you're not able to, then a lot of patients then they don't like it and they want to come back to have it reversed. And that's definitely something that we can do. Okay. And then number two is changing the shape. So yes, a lot of times we can change the shape, and we can also kind of reduce things a little bit. And that's something that we're seeing more and more now here at Pure. So a few years ago, say maybe 5 years ago, we were going for like very kind of exaggerated looks, a lot of like big bubble butts, a lot of lats and things like that. And those looks have fallen out of favor a little bit because they're very kind of surgical looks, and they tend to be not very long lasting. Okay, so patients now want to come back and go for more of what we call an enhanced natural look. Okay, and create more of an upside down heart shape as well, and reduce a little bit of the buttock, reduce a little bit of the hips, and create a shape that kind of fits their frame and fits their foundation. That's what we specialize here at Pure Plastic Surgery. So yes, you can come back, we can reverse the ab etching, we can change that shape, make it something that fits your frame and your foundation, and which means that it's going to be something that's much more longer lasting. You're not going to be coming back over and over again for more and more surgeries.
Okay, how many massages do you recommend after Lipo 360 and BBL?
So I recommend a minimum of 20 in total. Minimum of 20 in total. Actually, the number that I typically give is 21. Why is that? Because I like to separate it into 3 groups, which kind of makes it easier for the patient. All right. So the first 7 you do daily, and you start as soon as the next day after surgery. Okay. The next 7 you're gonna do 2 to 3 a week. Okay, start spreading them out just a little bit more, 2 to 3 a week. All right. That'll get you to 14 massages, right? And then the last group of 7 you're gonna do weekly. Okay, so daily, 2 to 3 a week, weekly. And that's gonna get you to 21 total massages all right, which for most patients is adequate. Now, some patients may need a little bit more, all right, but definitely no less than 20 massages. All right? Okay, everybody, so I think that kind of concludes the talk and the question and answer period, but I have one very, very important question, which is going to require your cooperation, okay? All right, here we go. You guys ready for the question? It's super, super important. All right, you guys have noticed that that I have the mustache going on for November, so I want you guys to tell me. All right, it's going to be A, B, or C. All right. A, Dr. Earl, that mustache looks really cool, rough and rugged. All right.
Hey, cool.
Okay. B, looks like a porn star. Or C, what is that? It makes me want to run away. It looks terrible, Dr. Earl. Please get rid of it. Okay. What are you guys thinking? A, really cool. B, giving out porn star vibes. C, I hate it. I want to run away.
Okay, the followers start laughing. So Boosie says A.
All right.
Mary says B. Another A. Another A.
All right.
Another B.
Some cool points and porn
Yeah,
star
another
vibes.
A. Another B. Another B. Oh, another B.
So we're somewhere in here.
Another B. Another B. Doug.
All right. I guess that one's winning then. All right. At least nobody wanted to run away. My wife hates it. She actually I think runs away for the month of November. But all right. I think B won.
B one.
All right. Awesome. All right, everybody. Well, thank you for that. I want to remind you guys once again, if you decide you want to have surgery, you're going to fill in that virtual consultation form. Make sure you give them the secret password, okay? Secret password for today was BMI. All right, so you can get anywhere from $300 to $1,000 off your procedure. All right. So as soon as that coordinator calls you back, you tell them I have the secret password for this week. It's BMI. Give me my discount. Okay? All right, everybody. It's been really cool hanging out, and I look forward to seeing all of you next week on Hump Day with Dr. Alex Earl. Take care. Ciao.